You now? Is it time for you to reclaim your health? Have you been struggling for years and years and wondering, why am I not feeling my best? That there needs to be something more? Well, I want to tell you, there can be so much more. So many women are going through changes in their lives. Women from childbearing to kids are growing up, and then we get into these perimenopausal and menopausal times. And often we're feeling a little bit lost. We don't know where our direction is. And I've gone through these changes as well. You know, I'm a 54-year-old postmenopausal physician. And even for me on my journey, it's been a little difficult at times because in the healthcare profession, we tend to put Band-Aid treatments on a lot of things. But what I've learned through my time and through my process of growing is that there can be a system and there can be a way that we can start to address the person as a whole. And I think within the way that healthcare is kind of working right now, because especially in Canada, we're seeing a shortages of physicians, and this is countrywide, that you need to have knowledge so that you can become more empowered, so that you can take the steps that you need to do to really get to this part of your life where you are completely thriving and you're moving beyond just that survival mode. You know, I saw a patient just earlier this week and she's like, I'm into my best years, but I still don't feel good. And there's all these conditions and I'm seeing all these physicians and people don't know how to put the pieces together. So what I've been working on through my own journey and experience is a way to get the system put together so that you can reflect on what's going on in your body and then begin to take steps to address it. So the system I've built is for women that are going through this perimenopausal change. And I wanted to have something that would give you a sense of understanding the many issues that are going on within your body and that there is a connection to all of those issues. So the system I've developed is called MenoMaps. And this is to help you kind of look at what areas all your symptoms may begin to fit into. Because one of the things that we know with women, we have a lot of amazing hormones in our body. Some of those chief hormones are estradiol, progesterone, testosterone. But we also have hormones, insulin, cortisol, and thyroid hormone. All of those work together and they are working in a system. So when one is out of the balance, it's going to begin to impact other areas of the body. Once you hit around 40, and for some women it's even younger, we start to see changes in progesterone. And this is just a natural change that can happen. And then later on, we'll begin to see testosterone changing. We'll see estrogen dropping down. And that will also influence the way that thyroid hormone, insulin, and cortisol are working. So all along the way, these hormones are working in balance. And these hormones in our younger years, they're really there to protect us. In our younger years, they're there to help us with procreation, with conception and reproducing our species. But what happens is, as you go through perimenopause into menopause, if you haven't built in your life pillars and your foundations of health, then your body starts to struggle a lot more, especially as progesterone, estrogen, and testosterone get decreased in your body. And this is where we see these changes of health that go on in a woman's system. So what are some of these key changes that I want to address in the MenoMaps? And again, this is a brief overview, but I hope it's going to help you to start to put these little pieces together. So number one, so we've got MENOMAPS. And I designed this because I want you to try to figure out the map of where you're at. So M, we have musculoskeletal. So what do we see start to change? Our muscles, our bones, our joints. This happens in perimenopause and in menopause. And for many women, they even see this throughout the month as they're going through their menstrual cycle. Then we have E, energy and metabolism. So if you've been feeling a little bit blah, a little bit low, maybe a little bit of brain fog, or maybe a little bit of weight gain, we see this because as estrogen change, the weight can begin to shift in the body. And there's a lot of things that are going on in this category. Then we have N. So N is our neurocognitive and our mood. So our brain begins to change as we go through perimenopausal transition. Now, this is amazing. I really love studying neuroscience because this doesn't need to be anything scary, but it's truly what's going on in the body. We can actually now map out where estrogen changes, where progesterone, testosterone changes within the brain. And this is fascinating. But it also tells us that we really need to know that we have to pay attention to know that how do we respond to these changes? And also, if we're starting to sense a change in mood, a change in memory, this may be sending a signal out to us that we have to pay a little bit more close attention to that area of our body. But of course, there's ways that women need to get ongoing support during this time because we do see a lot of anxiety and depression that can begin to happen. And a lot of times it just gets labeled as anxiety and depression, but we know that hormonal changes are really influencing this. And also the recent menopausal guidelines actually tell us to bring this up with women. So then we come into O. So O is your organs that are getting under pressure. So what are some of the key organs? So number one is the heart. We often see women having more palpitations when they go through hormonal shifts. We can see cholesterol begin to rise. We can see the thyroid start to change. Many more women are diagnosed with Hashimoto's or thyroid conditions in their 40s and 50s. We see the liver begin to change. Fatty liver disease goes up threefold as women go through menopause because of changes that estrogen has a little impact to play at the role of the liver. And also we see changes in the gut, chronic constipation, irritable bowel syndrome, because again, estrogen and the hormonal changes that happen within the gut. What's really interesting and a lot of women aren't aware of is that we have a group of bacteria in our gut that make up what are called the estrobolome. And these bacteria influence how our body manages estrogen. So again, if you're coming into a menopausal time change in your life, and maybe you've had IBS or Crohn's or colitis, then if your gut microbiome and your estrobolome are not balanced, then this may further influence the way that you're going to feel as you go through the menopausal shift. So then let's build into the last four. So we've got M. So here I talk about mucosa and genitourinary. So women, this is our private parts. And this is things like our libido that we don't maybe always want to bring up in conversation. But what do we know? That libido does go down, okay? It can go down at many points during our life, and there can be many factors that impact it. But also we can see recurrent bladder infections, recurrent vaginal infections that can happen. And again, this is a shift on many different levels in our body. Then A. So this is one that is highly overlooked in the menopause space. So I want you to listen into this part. Airway and sleep. So many women have a condition called sleep disordered breathing. Now, I've seen this in many of my patients. It can manifest as full-blown sleep apnea. I test the majority of my women for sleep disorders because I've seen sleep apnea that can be quite striking, and that really needs to be managed because sleep apnea untreated can put a large strain on the heart, and it's a high risk also for insulin resistance, diabetes, and for women that are having difficulty losing weight. But what you may not know is that many women get sleep disordered breathing. It doesn't always meet the criteria when you go to a sleep lab, because sleep labs kind of give you, it's either a sleep apnea diagnosis or not. But in working with a good friend at Navi Sleep and in doing longer term sleep studies, even 7-night sleep studies, we're able to see that many women have a sleep disturbance at night, and this fragments the sleep. It can raise cortisol levels. It can raise blood sugar. And if this is not treated, this can really go on for years and years. And this can actually be one of the reasons why women are really not thriving, because they're having fragmented sleep, and this is causing a whole host of symptoms in the body. So then P within our category here on the MenoMaps. So P is our perception and our sensitivity. So many women start to have sensations as they go through changes where they have a change in their pain perception. They have a change in their skin. They can have dryness. They can have dryness in their eyes. They can have itchy ears. And these are symptoms that come up. And often, as doctors, we're not really told how they're connected. And sometimes we'll give creams or we'll give this or that. And many times I see that women are told it's all in the hormones. But often this goes a little bit deeper. It can be into your nutrients in your body. We know in particular that vitamin D drops during perimenopause and menopause because of the vitamin D receptors. We know omega-3, the way that we balance that in our body, drops because of the change in estrogen on those receptors. If we don't get those two things balanced, we can run into issues. We also know vitamin B12 and the B vitamins are a huge part of our metabolism. And if those are not well managed early on, then again, this can manifest more as we go through the menopausal transition, okay? And then our last one. So our last one is actually the most common one that everybody thinks about. And this is sweats. S is for sweats and vasomotor symptoms. The hot flashes, the night sweats that many women get. And, what I see is that a lot of times women think that this is all that menopause is about. It's about the sweats. But I can tell you the reason that I've developed MenoMaps is that I want you to understand that this can be so much more. And it all fits together in a system. If we try to break things down, and I see this happening a lot, is that we break down the musculoskeletal, the energy, the mood, the organs, the mucosa, the airway, the pain, and the sweats. And what we can often end up with is that we can have hormonal replacement, which is wonderful. We can have estrogen and progesterone, and maybe testosterone as well. But if we haven't managed all of the body as a system, then we can really be missing out a lot. And women are still not feeling optimized. And this is what I want you to understand, is that optimal wellness is possible when you take a systematic approach. So this is what I'm building. Over the next 6 months, I'm going to be having more programs and workshops based on this. But if you want to get a sneak peek into what I'm building, I am going to be offering on Wednesday, the 22nd, coming up very soon. But I am going to be offering my first ever, it's going to be a workshop on addressing these issues with women. It's going to be hosted here at the Miramichi Naturopath Clinic in Miramichi, New Brunswick. I will have some links as to how you can join it. And this is going to be my initial little snapshot for those that want to come and work with me on trying to put their pieces together. We can talk about this, but we're going to sit down in a circle and begin to really talk about the symptoms that you're having. So if you're interested in that, the link is going to be in the bio. Please join to register. And also, I have a system to try to help you put the pieces together. And this system is called The Next Chapter. And it's a weekly mentorship that you get live access to me, live access to special guests, and very soon we're going to be having a dietitian come on board in this program. So this is called The Next Chapter. If you're interested, please check out the link as well to that in the bio. I want you to remember that you are not alone on this journey, that we need to connect together and we need to spread this word to more women. Because I know many of you are feeling a little bit lost, that maybe your physician doesn't understand. Maybe you can't get into the next menopause clinic, but there's ways that you can work to learn more information. And this is what I want to do here on this channel. I want to work with you. I want to tell you what I wish I knew 20 years ago. I want to tell you the information that I'm learning every day so that I can help my mom that's in her 70s, so that I can help my sister in her 40s navigate early perimenopause, and that I can help my nieces as they're just going to come into their time of becoming a woman. And it really is exciting. I think being a woman is incredible. It really empowers us in many, many ways. And I think that we need to be able to connect so that we can support one another. And this is what I want to do here for you. So please continue to follow me. I'll be back here again Fridays at noon. If you miss the replays, you can also follow me on YouTube. But thank you all for joining me today. Take care and have a wonderful day.